Thank you. Next witness.
My name is Barbara Finn, and I live here in Sacramento, and if it wasn't for MSSP, I wouldn't be here. They're responsible for keeping my scooter going and also for the noise we had a few minutes ago. But their services are extraordinary, and I'm 79 years old, and many of my people of my age are already in homes costing thousands of dollars. Thank you, MSSP.
Thank you for coming today. I appreciate it. I missed the noise, so I missed all the excitement, apparently. Next witness, please.
Deborah Doctor from Disability Rights California. We also believe that actually producing a great product that is of obvious benefit to the beneficiaries would be the best marketing tool rather than trying to assure people of something that they have no evidence of. I don't know that any of you, if you were offered the choice of maybe losing your doctor for something called integrated management, would be appealing to you. It wouldn't be to me. I would want to know, what the heck does that mean? What's in it for me? And when we get to the point where there's an honest answer for that, and it's a good answer, I would think people would take up this product. That's why we, over years, recommended that it be done voluntarily. I agree with the staff's recommendation that we have insufficient information, and I would say especially on the long-term care side, we have no idea what assessment tool is being used from one plan to the other to assess the need for long-term services and supports. I have no idea whether anybody's getting additional benefits. We are pretty sure they're not getting benefits of additional IHSS hours unless it's done through an agency, which is expensive, because there's no capacity in our CMIP system right now to pay for any additional hours beyond those that a county would approve. There are, a couple of years ago, you were all promised that people would be able to figure out what plan they could go into based on whether their doctor was a member of that plan. That was an assurance we all got. Turns out not so much. Some of the plans, yes, but in other plans, there's a delegation down to a smaller level of the smaller practice level, and the fact that your doctor is part of the overall managed care plan tells you nothing about whether or not your doctor is in the particular IPA to which you would be assigned. So there is really no way for people to be assured that they would continue to see their physician, and I suspect that that is a big disincentive. We know nothing about accessibility. We know no more than we did when we were talking about this a year ago and 2 years ago, whether people have had trouble, people with disabilities, including seniors, have had trouble getting into offices or getting materials in other formats. Maybe there has been no problem. I think it speaks unfortunate volumes that we're using information from November to talk about what's happening. And I know there are intentions of having more real time, but meanwhile, people are now going to be subject to advertising material in the voluntary enrollment. And so it's concerning that they'll have even more advertising with no additional information on what's in it for me. Thank you.
Thank you very much. 2 minutes, please. Next witness.
Laurel Mildred on behalf of the California Association for Adult Day Services, representing California's 246 CBAS centers serving elderly and disabled individuals. We agree with the staff observation that some of the important tools and analytics for oversight of the CCI are not in place. We've previously given testimony to this committee about the damage that the rate cut has done to our provider network. It's effectively put CBAS centers on the endangered species list, and we have 2 specific suggestions for some oversight. First, the state's exemption process for examining when providers need an exemption is severely flawed, and it's not operating to ensure programmatic access. And secondarily, network standards, adequacy standards for long-term services and supports have not been implemented yet. So without those tools to ensure access in light of the rate cut, you have a real negative situation developing for access in the CCI. Thank you.
Thank you. 2 minutes.
Hello, my name is Denise Leiker, and I am from Independence at Home, a division of SCAN Health Plan, MSSP site director serving Southern Los Angeles County and many in your district, Madam Chair. And I'm here today to just reinforce about the MSSP program and the importance of really handling this right. Thank you to the department for acknowledging that they're open to continuing to have conversation about the transition, but we have to keep in mind what this population looks like. This is nursing home certifiable. Some of our seniors in our community, some of the most frailest and fragilest, who are been relying on MSSP for more than 30 years to do the care coordination that managed care is now being just starting to learn to do. Professional nurses and social workers doing it all, managing not only their health, managing their social needs, managing their mental health needs in the home, hands and feet on the ground in these communities. Nobody knows this level of care like we do, and we're here to partner and help them learn, but none of the objectives in legislation have been met. We're still dealing with basic startups 7 months in and 12 months out from the end of the 19 months. So we're here today to really reinforce that although there's been conversation going on, at some point we've got to stop the focus on that timeline, make the timeline more realistic so that both managed care and MSSPs actually start care coordinating together. We can learn from it and inform a model of care that's really going to take care of this most vulnerable population. We don't get this right for this population, they're going to fall through the cracks and frankly end up either in nursing homes or die. So we are really requesting that we speed up these conversations and that 19 to 36 month conversation really get settled so we can really start working together on a plan that makes sense. Thank you.
Next witness.
Hello. Thank you, Senator Mitchell and Senator Monty, for the opportunity to address you. I'm John Balutz, Executive Director of Health Project Center, and I'm also Director of the MSSP for Santa Cruz and Monterey counties. And I'm here to urge everyone to make sure that we sustain the MSSP system during this transitional period. My organization took over the MSSPs when the counties essentially gave it up because they were losing $500,000 a year running it. They were having to subsidize it. We're able to now run it for these highly frail, needing, individuals in need because we're efficient. We've been able to keep costs down, and we're able to access services locally at a low cost or for free because that's what we do. We've, really developed a system to help those at need. And unfortunately, at this point, the uncertainties in transition, the fact that the program has been flat funded for years and years and years, it's coming to the point where I'm concerned about the actual system being able to be sustained through the transition, which we all want to happen. And I'm really glad to hear that there's some flexibility being expressed on how long that transition would take. I think that's really important. But we want to make sure that by the time, the transition does happen, which may be extended, that the system of specialized services that we are able to provide now is still in place. So I really think it's important to look at, in the meantime, sustaining it. Funding is important to that, and flat funding forever doesn't work. When transition happens, hopefully that can be solved. However, in the meantime, we got to really be careful that we're not letting down our frailest seniors. Thanks for the opportunity.
Thank you very much. Next witness, please. 2 minutes.
Good afternoon. My name is Susan Fila. I am an MSSP site director at Jewish Family Service of Los Angeles. We serve approximately 600 MSSP members in the Los Angeles County. I'm actually here today to talk to you about Mrs. B. She's an MSSP client who couldn't be here today because of her increased frailty. Mrs. B is a 91-year-old Holocaust survivor who's Russian-speaking only and lives in a small one-bedroom apartment by herself. During World War II, World War II, Mrs. B's entire family, mother, father, baby brother, were all taken to gas chambers and executed. Mrs. B worked in a labor camp and was the only survivor of her entire family. After the war, Mrs. B immigrated from Russia to the US and moved to LA, where she still currently resides. Today, she's a widow and has outlived her 2 adult children, who died of cancer and diabetes several years ago. She has no other living family in Los Angeles and has very limited social supports and resources. Her MSSP care manager and nurse care manager have been the same providers for the last 8 years, and they provide that continuity of care that all of our MSSP members need and deserve. Both the MSSP care manager and nurse care manager happen to speak Russian and have been able to help Ms. B navigate through the system of IHSS, MSSP, and public benefits that she's eligible for. Like many other MSSP clients, she never received a CalMedi Connect notice in the mail. Instead, she was passively enrolled in one of the 5 plans without her knowledge or consent. The care manager discovered she was enrolled by running her eligibility sometime at the start of the demonstration. Mrs. B's doctors didn't accept the CalMedi Connect plan she was enrolled in, and so, with the assistance of her IHSS provider, she opted out. Ms. B has had the same doctor for over 10 years, and so having a different doctor was not an option. These are the kinds of issues that are all too common with our MSSP clients, and if it was not for her MSSP care manager, she would end up being refused at her doctor's office, and not only be confused, but be alone. There are a multitude of issues that the CCI County MSSP sites are experiencing. These include some of the things I mentioned, which are clients switching plans without their knowledge or consent, clients moving in and out of plans, clients moving back to Medi-Cal fee-for-service without an explanation from the state. There are 5 different plans with different data submission reporting needs and requirements, ongoing billing and payment discrepancies, clients experiencing difficulty and long wait times for translation services when they call the plans for benefits. I urge the committee to grant us the full 36-month extension. This will ensure that members like Ms. B have a smooth transition into managed care, and they'll be able to live with dignity and respect in their homes. Thank you.
Hi, I'm Nancy Volpert. I'm Director of Public Policy at Jewish Family Service. Mrs. B is one of ours, and we're proud to claim her. I wanted to just go back to the 36-month extension. I'm delighted to hear the department finally talking about being open to a discussion, but being open to a discussion is not the same thing as being ready to extend the timeline for MSSP to match the length of the demonstration project. As was noted in the committee analysis, the existence itself of CCI is unclear. The governor's budget in January suggested that if financial goals are not met, the plug will be pulled. And there is a significant possibility that come January, we will be facing the dismantling of a system, and MSSP, which is a cornerstone to it, will have fallen apart before then because it will have stopped existing or will be about to be closed. And so we are relying on the legislature and our colleagues at the Department of Health Care Services to come to a meeting of the minds to extend and protect this critically important service that you've heard described by my colleagues ahead. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Eileen Kuntz, and I am the current MSSP Site Association President. I am also the site director at Huntington Hospital in Pasadena. We serve 375 individuals, frail individuals each month. And our site has been around doing this for 30 years. I've, in my time in healthcare services, not seen this sort of level of chaos for the clients that we serve. The biggest concern that I have, I think my colleagues have done an excellent job kind of queuing up and laying out the sorts of issues that we're seeing, and I concur with all of those. The biggest concern that I would have about all of this is there is really no plan for those 78% of people that are in managed long-term supports and services, in a Medi-Cal managed care plan, not in CalMedi Connect, because they've either opted out, they don't qualify, or whatever. Those individuals have no ability to get assistance with medical management because the health plans have been exempted from that. And so in the absence of understanding what the MSSP transition plan is really going to be and how are those benefits going to be retained, I'm left to be very, very concerned that these frail individuals will be left with nothing. Because currently we see no evidence of care coordination happening at the health plan level, at the IPA level with our clients, and it's our staff continuing to provide the services we provided to them all along that is what's helping them through this transition. And so I just really urge you, I thank the department for being open to an extended transition. I just urge the committee to help make that happen because we've got a lot of work to do.
Thank you very much. Appreciate it. Next witness, 2 minutes, please.
I think it's almost good afternoon,
Yes,
Chair and Senator Monning. My name is Debbie Toth. I'm the CEO of Rehabilitation Services of Northern California. We are a community-based nonprofit that's been around since 1949, and we have a host of long-term supports and services that we provide in our community. I'd like to align myself with the comments made by Laurel Mildred on behalf of CADS, as we have 2 adult day health care centers as well. And we have grave concerns about the whittling away of that program. Secondly, I'm here on behalf of MSSP. I too, like John Balutz, saw our county give up MSSP because it was costing them $500,000 a year above and beyond what the grant was. And we are receiving less money than what they received at the time that they gave up the program. One of the things that concerns me, and I align myself with all my previous colleagues' comments, one of the things that concerns me in the transition, and I absolutely think that the 36 months is a reasonable ask given it's a demonstration project and you don't want to remove the infrastructure before you figure out whether or not it works. We have a 12 by 12 shed in our backyard that has donated durable medical equipment, wheelchairs, walkers, continence supplies, you name it. Are the health plans going to be able to have something like that they can give their consumers? Do they know what churches provide rides or provide foods in people's homes? These are things that, to me, a health plan doesn't provide. And so how do we partner to make sure that we don't lose those resources in the transition? We have to have time to have that conversation and figure these things out because we don't want to lose those resources. And certainly we need to safeguard the people who are the frailest in the system. Thank you so much.
Thank you. Next witness.
Hi, my name is Dustin Harper from Institute on Aging. We're the MSSP provider in San Francisco County. I want to echo and align myself with the other comments my colleagues have made, but also wanted to highlight the effects of the uncertainty surrounding CCI and ultimately MSSP on us as a community-based provider. And ultimately, given all of the uncertainty, it is very difficult to garner local support and as well as invest in the program and infrastructure and things that are required to run any program, and certainly a program like MSSP. And I think it's really important for us to consider that the individuals that MSSP serves, they rely on a program like MSSP, and frankly, they deserve a strong program there. And so for the provider community, it's very difficult to operate in this world of uncertainty. So the extension to 36 months certainly would be a step forward in that direction. Appreciate it.
My name is Lourdes Ramirez. I'm the MSSP site director in San Diego County, and our MSSP program serves 550 frail seniors. We are a CCI county, and I echo the words of my colleagues, and I urge you to vote for a 36-month extension. Thank you.
Thank you. Next witness.
Hi, my name is Jennifer Campbell. I'm a social work intern here at the local Sacramento MSSP site. We had a client here today that wanted to speak, but unfortunately he needed to leave, so he wanted me to share this with you guys. He said, I'm extremely grateful for MSSP services, and the staff members are very supportive. There's no way I would be able to afford the Medi-Cal supplies, transportation, meal services such as Thicket, clothes, blankets, and be able to remain living in my home without MSSP services. MSSP also provides me with the Link to Life emergency response system, which helps me feel safe when I am home alone. Paratransit tickets each month ensure I am able to attend all my doctor's appointments. Thank you.
Thank you.
Good afternoon.
Good afternoon.
I'm Claudia Dillard, and I live here in Sacramento. I am a member of MSSP, which stands for Managed Purpose Senior Services. And if it wasn't for them, I wouldn't be here speaking to you today. They have allowed me to stay in my home. Mm-hmm. They have allowed me to be happy in my home. Mm-hmm. They give me transportation. Whatever I need, I can call them and I can get it. I can't do that from the county or the city. And MSSP is very, very important. because I'm a terminally ill patient. And when it's time for me to leave this plane, I want to leave it at home. Thank you.
And thank you.
Hi, my name is Teresa Ogan. I supervise the MSSP program here in Sacramento, Placer, and Yolo counties. You've heard the voice or heard from 3 of our beautiful seniors. And I really want to thank them for coming down. It's a real chore for them to be here and to testify.
And we appreciate that, and we would like to thank them as well.
Thank you.
Especially sitting in this sub-zero hearing room. We apologize.
Amen to that. And so I just we wanted to make sure that you had an opportunity to meet some of the seniors that this program impacts on, and to understand what a challenge it is for them to access services, and trying to push through a program too quickly really puts them in detriment of being, having to leave their own homes before they're ready to. And that should be a choice that's made on our own, and not because we run out of money or run out of services that have been provided. So I encourage the acceptance of a 36-month extension. And it also never hurts to have some more money to serve our clients with. Thank you.
Thank you very much. Next witness, please. 2 minutes.
Hello, Madam Chairman. My name's Alan Masden. I'm from Reading, and we serve, we have an MSSP. It's easier to use the letters than it is to say the name. In Shasta, Siskiyou, Trinity, Laston, and occasionally Modoc County. And what we have is lots of distance. We serve about 220 clients a year. And I'd just like to point out that we're talking about folks who are very, very poor. And one of the benefits of our program is that we gather resources in the community, donated and otherwise, and we purchase services for people that they would not otherwise be able to have. And again, the independence in their home is what the goal is. It's their goal, and that's what we support. Thank you very much.
Thank you. Next witness.
Afternoon. My name is Stephanie Navarrete, and I'm the site director for MSSP in Stanislaus County. And we're a non-CCI county, but I'm here in support of my colleagues, of course, and to urge you to look at the 36-month transition. And basically, it concerns us as we're listening to stories come from the CCI counties and looking at what managed care are trying to do and getting the care management in place. We recently had a client come into our county, brand new, and he was being case managed by phone. He's Spanish-speaking only, illiterate, and he'd never seen anybody, but they were trying to manage his medications and things like that. So when he moved to our county, we were able to actually send my nurse out, send the social worker out, work with the local pharmacy to get something color-coded for him, so something that he would understand. So, for some people that's a small thing, but for him it was everything. So, I think it's very important to take time to make sure that we put things in place so, these small things won't add up to bigger things. Thank you.
Thank you very much.
Madam Chair and Committee, thank you. My name is Dr. Barbara Porter. I'm the site director in Contra Costa County. You just heard, I could say ditto to everything everybody else has said, so I won't regurgitate all of that. But what I want to leave you with is that while we serve 160 people, the average age is 84. Most of them live alone. Most of them have no family support. These are people that, when you think of it, I want to put a name and a face to it. They're just not numbers. These are people who have incredible medical, safety, environmental care needs, and there's nobody around. MSSP is their foundation and their absolute support system, and without that, what I fear is if we don't get it right with CCI transitioning into managed care. I lived through the adult day health care transitioning into managed care for a CBAS, quasi-ADHD. What we want to make sure that happens is that everybody understands we need time to do it right. And I want to leave you with one thought. We have trained professionals. We have MSWs, which stands for Masters of Social Work. I call them something else. I call them masters of scrounging whatever is needed for the client. And by doing that, we not only have a storage shed, I've got a closet in my office that's filled with diapers and Depends and things that clients need that they literally cannot pay for. And we have families that have their loved ones die and they bring it in and they donate it. We need to partner so well with the managed care organizations so that they know we're working with you, not against you. So thank you so much for your time.
Hello, my name is Elisa Larcon. I'm from Santa Clara County, Sourcewise. I supervise the MSSP program where we currently serve 375 clients and ages ranging from 65 years of age to 104. That's our oldest client right now. And we are a CCI county, and I couldn't tell you right now, it's chaotic for our clients to navigate the managed care system. So I'd just like to echo what all of my colleagues have said, especially what Barbara just said. I strongly recommend that that you consider the extension of the 36-month expand for the CCI. Thank you.
Yes, please.
Madam Chair, members, Gary Passmore with the Congress of California Seniors. I just want to maybe try to do a quick reset, push the reset button for a second and remind everybody that CCI doesn't stand for Cost Containment Initiative. It has to do with care coordination. And there is nothing that exists in the state of California to deal with the population that we're talking about, the frailest, sickest, and oldest population that looks like and feels like and sounds like care coordination as much as the MSSP program. We've got to extend it. We are late in getting the CCI off the ground, and we need to even think, I'm convinced, about how to make the MSSP survive after CCI is fully implemented 58 counties. And Mary Cantwell knows well, I'm a strong supporter of the CCI. We need to streamline and improve the care that these vulnerable and high acuity people need. And I'm telling you, MSSP is the way we have today to do that, and we need to hang on to it. Thanks.
Thank you, sir. Next witness.
Madam Chair, members, Robert Harris on behalf of SEIU California, and this is going not to MSSP, but back to the beginning of what Deborah Doctor suggested, which is we know that care plan options as a part of the CCI is a critical part of getting people to want to sign up because it's giving people things that they can't get any other way. Unfortunately, when care plan options were adopted and when the CCI was adopted, one of the promises was not only could people get more IHSS if they needed it at one time, but also if they needed beyond the hours. But we neglected to institute a way to let the plans do that. And so we need to reprogram CMIPS too. We've been having conversations with Department of Social Services, but it actually would be a selling point when you're getting people to voluntarily enroll to actually have cases where, look, you can get something out of this that you can't get any other way. And so we need to reprogram CMIPS too so the plans can pay for it. Some of the plans, the plan that's been doing this the longest, the Health Plan of San Mateo, now is in support of that. As plans get more experience with what they can and can't do, more and more of them will be in support of doing that. It's a small cost and it's a huge benefit both to making sure the CCI is a success, but in providing better care for people. So we'd like to recommend that the committee look at that. Thank you.
Thank you. Final witness, please.
Madam Chair, members of the subcommittee, Fred Main on behalf of CalPACE, the trade association representing the 11 PACE organizations in the state, which we believe are doing a proven model of coordinated care. As the committee knows, CalPACE is an enrollment option in the CalMedi Connect portion of the CCI, and the department has been very good at working with us on a number of the administrative issues, but there are two enrollment issues that may be statutory issues for the CCI and PACE. First, while PACE can be an option in the MLTSS portion of CCI, we're not included in any of the enrollment materials or information that goes out from the state. We think it's very important that in those materials, PACE is listed as an option, so we're not seen as some other program coming in a ladder marketing type of activity. And then second, a number of the individuals who have chosen PACE on their first enrollment, a significant amount of them, about 40% by our calculation, the information that is in the state database has not been accurate, so we can't follow up with them. There's been some issues as to health information, HIPAA protections that we're trying to work through, but to the extent that there can be a clarification that PACE would have access to that information at an earlier time, it would be very helpful. Thank you for your consideration.
Thank you very much.